Thank you all for joining us today on our breast cancer awareness session. My name is Hawra, and I'll be your host today. So please help me in welcoming our speaker for the event. She is a pioneer in women's health. Oh, wait, one second. She is a strong advocate of women's health and a pioneer in setting up the first women's health clinic in Bahrain. She is also a consultant family medicine, an associate professor in RCSI, as well as the Medical University of Bahrain. Let us all welcome Dr. Ghufran Ahmed Jassim. Please, applause. Thank you.
So good morning, everybody. I'm very happy to be here today. Thank you for the introduction, Hawra. And without any further ado, let's start our talk about breast cancer today. As you know, October is the month of breast cancer awareness, and we do those sorts of talks every year in October to increase the awareness of breast cancer. You might have heard this information before, but I'll try to summarize them and then open the floor for more discussion towards the end. We will cover today how common breast cancer is, what is it, what are the risk factors, how it can be prevented, and what can be done at this stage. First of all, as you know, breast cancer, why is it important? Because it's simply the most common cancer among women, and not just in Bahrain, all over the world. And it accounts for almost 37% of all cancers in women. If you look at this graph, you can see that breast cancer ranks number one among cancers in women. And in fact, Bahrain has the highest incidence among the GCC, the Gulf countries. Now, this could be a true high incidence, or this could simply mean that we have better statistics and better registry systems since we are a very small country and every single case is being registered. We don't know, maybe this, maybe that. If we look at Bahrain among the world, we can see that Bahrain lies in the middle. There are countries with higher incidence, such as UK and US, and there are countries with lower incidence, such as Saudi Arabia and China. So Bahrain kind of lies in the middle with average, let's say, incidence of breast cancer. To better understand breast cancer, we need to look at the composition of the breast. In very simple ways, the composition or the breast consists of the lobules, the purple lobules, and then the ducts, which connects to the nipple. And then all of this rests on fatty tissue, and all of this is being connected to lymph nodes and lymph drainage, where the lymph is being drained. So normally, the breast cancer arises from the duct or from the lobule, mostly from the duct or from the lobule, the purple structure of the breast. And then when it gets metastasized, it goes to the nearby lymph nodes or nearby structures such as the lungs. Now, a lot of people like this slide. A lot of physicians present this slide. I don't like it because I don't want women to reach this stage at the presentation. These are how breast cancer can be presented. So they either present as pumps, lumps, nipple discharge. I would say any change from or any deviation from the normal should be reported, okay? Because an inverted nipple can be normal for some women and it's not normal for other women. So any deviation from what is normal for you should be reported as opposed to these symptoms and signs. What causes breast cancer? Simply, we don't know the cause for a breast cancer, not just a breast cancer, all forms of cancer. We don't know the cause of most forms of cancer, but we know the risk factors. So for some reason, there are mutations or changes in the DNA, in our genetic material, and this change leads to proliferation of the cells lining the ducts or cells lining the lobules, and this results in increase in their numbers. So that's what happens in breast cancer, but we don't know what initiates this increase in the number of cells. However, as I said, there are risk factors for breast cancer. One of them is simply being a female, being a woman. So does this mean men don't get breast cancer? They do, but very low incidence in breast cancer. Second, aging. As you know, cancer is a disease of aging. And not only cancer, all chronic illnesses, diabetes, hypertension, all chronic illnesses are diseases of aging. As we age, the risk of having cancer is increased. Second, having family history. As you know, especially first-degree relatives, such as mothers or sisters, increases the risk of women to have breast cancer. Does this mean that every woman with a family history will get breast cancer? Of course not. But it will simply increase your risk of breast cancer, whether you have a first-degree or a second-degree relative with breast cancer. And it means that you need to get checked perhaps earlier or more frequent. Having menstrual history or checking your menstrual history also might give us an indication of the risk, especially if you have your first period or menarche at an early age, or if you have your menopause at a late age. The logic behind this is maximizing the exposure to estrogen, because when you get your period at an early age, or when your period stops at a late age, it means you are exposed to estrogen for a long time or a long period. Having your first child after the age of 30 or having no children at all. These are the risk factors again. And one of the recent risk factors is having dense breast, which increases the risk of breast cancer as well. Now, breast cancer has several stages. And these stages depend on the size of the tumor, the extent of involvement of adjacent structures and lymph nodes. So for example, if you look at stage 1, in stage 1, the tumor is very small, it's tiny. In stage 2, the tumor is a bit larger. And in stage 3, the tumor is even bigger with some involvement of the lymph nodes. And then in stage 4, the tumor is bigger, lymph nodes involved, and the lung is also involved, okay? So our aim or our a message that we're trying to get across in these awareness lectures is that we want to detect the cancer or the lumps as soon as possible, as early as possible, when it is in stage 1 and not in stage 3 or 4. That's the aim of breast cancer screening. As I said, these are the signs and symptoms, and again, my key message to you is you have to report any changes, any deviation from what is normal for you. Screening for breast cancer. So when we say screening, we mean early detection. That's what screening is. Since we don't know the cause of breast cancer, the only way we deal with this disease is to detect it as early as possible. That's the only solution, because we can't prevent it. We don't know the cause. So the only solution is to detect it as early as possible. And how do we do that? By one of those screening methods. So we have several screening methods. We have the breast self-examination that a woman does every month. The clinical examination, which is done by the physician. We have the mammogram, which is an X-ray of the breast. We have the ultrasound, and then we have the biopsy. So let us look at the breast self-examination. Breast self-examination is basically examining your breast usually after the period, and this could start as early as the age of 20. And although this is no longer in the screening guidelines by the screening agencies, but you're not physicians and you're not expected to diagnose a breast cancer, but you are expected to know what is normal for you. You are expected to be familiar with your breast and with the way your breast look, because you are the first person to spot any changes if there are any. You will be able to say, this is not normal, this is different, I need to get this checked. So that's the aim of a breast self-examination, to know what is normal for you so that you can report any changes immediately to your physician. The clinical breast examination is the same examination but done by a physician. The mammogram is the most famous, let's say, screening technique or modality, and it's simply an X-ray of the breast where the breasts are put between two blades and then a picture is taken. Mammogram is usually starts at the age of 40. That's the guidelines, at least in Bahrain. And in most guidelines, mammogram starts at the age of 40. And there is a reason for this. I'll explain in a minute. However, if a woman has any symptoms, if you have risk factors like family history or other risk factors, you might need to get checked earlier than 40. You have to get checked before the age of 40. Don't wait to the age of 40. So this is the mammogram. A lot of women say it's a bit uncomfortable. I agree with that. You know, it's very sensitive part of your body being, you know, squeezed between two blades. So it is expected to be a bit uncomfortable. But what I usually tell my patient is it lasts for 5 seconds. You know, count from 1 to 5 and it'll be gone and the blades will be released. And 5 seconds will save your life. Think about it this way. And then if you are really in severe pain, we can always give you some pain medication to, you know, to alleviate the pain during the procedure. Now, this is why we set to the age of 40 for mammogram, because for younger women, mammogram is just, you know, looks very white because of the dense breast tissue in young women. So it looks white, and we will be unable to see what is behind this whitish, let's say, picture. So it can mask the tumors. And that's why, but then as you get older, the whitish connective tissue become less, and we can see a clear image of the breast. For younger women, we might sometimes prefer to do ultrasound or MRI if needed, okay? And the same applies for women with breast implant. If you have a breast implant, silicone or any breast implant, then again, we might need to do more sophisticated tests as opposed to mammogram, because the implant might mask what is behind it or the tumor if it is there. Why do we do mammogram? Why do we do those kind of tests? Because, as I said, this is the only solution. This is the only way to deal with the breast cancer, is to detect it as early as possible, because the survival is different, the treatment is different, the quality of life of patient is different. How can we, let's say, minimize as opposed to prevent? Because it's, we can't prevent it because we don't know the cause, but we can minimize the risk. Okay, how do we minimize our risk of breast cancer? Simply by staying, you know, by staying healthy, exercise, being active, reducing your weight. And I'm not just saying this as a general advice. I mean, this, you hear this for all types of diseases, all types of chronic illnesses and so on. Research has shown, evidence has shown that if you are active, if you reduce your weight, if you keep your weight healthy or, you know, maintained at least, this will minimize your risk of a breast cancer by 30 or 40% depending on how much you lose weight. So this is evidence-based. Be active and reduce your weight. Also make sure, you know, when we are seeing new mothers having babies, we encourage them to breastfeed, because breastfeeding does reduce also the risk of breast cancer. Now, there are other ways of prevention, especially for women who have strong family history or those who have the genetic ability or the genetic mutation of breast cancer. So if a woman gets tested and she found that she has the genes for developing breast cancer, that's now a different story. Now we have to discuss with her other options, such as taking some drugs to prevent the cancer, or some women might go even or take the extra mile and remove their breast before they get the breast cancer. So these are options that we need to discuss with the woman, and then she will be able to make a decision based on the information that we provide to her. As I said, early detection increases your survival depending on which stage the cancer is being detected. Now, this is what I call a hopeful slide. Not all changes that we see in the breast are malignant or cancerous. There are 80% of the changes we see are benign, which means they are not cancerous. They could be just simply cyst, filled with water, filled with blood, filled with the fat. There could be some tissues, collection of tissues. There could be some abscesses. There could be some, fibrous tissues and so on. So in 80% of the time, it is something not cancerous. Okay, so this is just to put people at ease. Now, there are so many myths about breast cancer, and I will just address the most common ones, the ones I hear from my patients. So a lot of patients think that if they don't have family history, it means they will not get breast cancer, and that's absolutely not true. Actually, 80% or 85% of conditions or breast cancers are not related to family history, or there are no family history in those women. A lot of women think mammograms are harmful because they are x-rays, and we should not do them because it might harm us as opposed to being beneficial. But the way I respond to them is that the amount of radiation in mammogram is very comparable to a normal chest x-ray. And you are exposed to the mammogram once in a year. Okay, so you are getting exposed to this small amount of radiation on annual basis. So we are talking about tiny amount of radiation that a woman is being exposed to in a year. Okay, so when we weigh the benefit-risk ratio, benefit is there, risk is here. So mammogram are not harmful as some people might think. Some people think also that malignant lumps are painless. Again, it's not. There is no rule of thumb for the lumps. They could be painful, they could be painless. Another common myth is use of deodorant or the use of underwired bra. A lot of people think this is associated with the breast cancer. There is absolutely no evidence to support that kind of claim. Another way of reducing your breast cancer risk is to check your vitamin D because it has been associated with the breast cancer. Avoid long-term use of hormones, especially after menopause. You know, some women use the hormone replacement therapy. So if you are using them, use them for the shortest possible duration and with the shortest possible dose. Quitting smoking as well can reduce the risk. So in summary, if you know someone who's diagnosed with the breast cancer, a family, a friend, or yourself is being diagnosed with the breast cancer, you have to know that you are not alone in this. Breast cancer is treatable, especially if detected in its early stages. You can live your life normally after being diagnosed and after finishing your treatment schedule or treatment duration. Now, there are many cultural aspects associated with the breast cancer in this part of the world, which could be sometimes different from what we see in the West. Examples are when a diagnosis is being disclosed to the woman, it's often a family decision. The husband, the spouse is usually involved in making the decisions. I have some of my patients, for example, they said, when I was given the option of chemotherapy, my husband refused. Or when I was given the option of taking the whole breast out or taking just the lump, my husband said, no, let's just go with the lump only, okay? So what I'm trying to say here is the husband or the spouse had a say in the treatment, okay? He was involved in the decision-making process. So for that reason, I think we should not only raise awareness among women, we should also include men in our awareness lectures because they are part of the decision-making process. Second, because our culture here, and again, our religion allows men to marry up to 4 wives at one time. So many women were a bit intimidated with the breast cancer diagnosis because they felt they might not be able to attend to their husband's need, and their husband now they have, other options of marrying other women and so on. So that kind of intimidation was not probably seen in the West, but it's clearly seen in our culture. And then there is always the fear of recurrence, something they always think about. Who will take care of my kids afterwards? Who will be responsible for their education? Who will be responsible for so on and so forth? So the fear of recurrence, fear of taking care of their families. So I guess these are the most common cultural, let's say, issues associated with the breast cancer, which is quite different for our women from women in the West. I think I will leave it at that. Thank you very much for listening, and we'll open the floor for questions and discussions. Thank you.
Thank you, Doctor, for that insightful presentation. I'm sure we all have a lot to think about and to discuss with our families and loved ones. So if anyone here would like to ask a question to the doctor related to her presentation today. All right.
Hello, I'm Anne Khatib Kamil from the GDN Gulf Weekly. So it was very interesting to me what you said about the culture aspect.
Yeah.
So how can we encourage more women and men to go get checked, especially on this side of the world?
Yeah.
How can we inspire them to do so?
Yeah, so first of all, I think what is important is what we see here today, that men are involved in the breast awareness campaigns. So involvement as early as possible in schools. We started to do the campaigns for both boys and girls. Breast cancer awareness, they used to be exclusive for women. Now both are involved. In our lectures, we always mention that there is a possibility that men, get breast cancer as well. Now, to answer your question, how can we encourage both men and women to get checked, is by the fact that breast cancer, as I said, is only, we can only deal with this disease by early detection of the disease. That's the only solution, early detection. We can't prevent it, but we can detect it as early as possible to increase the survival of women, to increase their quality of life, to make better choices in terms of treatment, and to minimize side effects of treatment. Now, I received a list of questions before the session, and I just would like to make one comment about those questions. So many of the questions were related to how breast cancer is treated, how is it managed, what is the duration of treatment, what are the side effects of treatment. So I just would like to make one comment, general comment about this question, which is breast cancer treatment is individualized, which means what suits patient X might not suit patient B. So the treatment or the management depends on which stage the disease is, how big the tumor is, where did it go, how far did it go, which structures are affected, at what stage, the component of the tumor itself, is it estrogen positive, is it negative? So there are so many aspects that we look at. We analyze the patient and the tumor itself, and then we put all the information together and we discuss the cases one by one, and then we decide on the management. But generally speaking, the first year following diagnosis is the most challenging year. After that, usually patient finishes their treatment and they start to regain their lives and their duties, and everything goes back to normal. Yes, there is a question there.
Thank you, Doctor, for an excellent presentation. In Saudi Arabia, we found out that there are many cases where cancer has been treated at the early stages.
Yeah.
However, recently, as recent as 3 to 5 years, the number of incidents had increased, not only there, but also in many of the Gulf countries.
True.
My specific question is on Bahrain. You've explained why is it that maybe it's the highest within the GCC. What else could it be? I'm trying to think culture, I'm trying to think food, I'm trying to think habits and norms, mitigation, any sort of background you can give us will be very helpful.
Yeah.
Thank you.
Thank you. It's a very good question, and I think to scientifically address your question, we need more epidemiological studies to study why why women in Bahrain have higher incidence of breast cancer. So we need proper epidemiological study. because we share the same culture, we share the same food, we share the same lifestyle, across GCC countries. What I think is probably, the reasons are related to maybe better health registry systems. Being a small country, all the cases are being reported to the registry. Better, let's say, screening programs and maybe uptake of the screening programs by our women is higher compared to other countries. Maybe, so it's maybe related to better screening, better registering of cases, probably. But is it related to other factors such as food, lifestyle, environment, pollution, or something else? I think we need proper epidemiological studies to address that. Thank you. Any other questions?
Hi, just a quick question. How long does it take to go from stage 1 to stage 2 to stage 3?
Okay, that's a very good question, because what most women don't realize is that breast cancer takes a very long time to progress and to happen. So it might, when you first see the lump, it means it has been there for decades. Okay, so it takes years for the breast cancer to develop. It does not develop over a year. It does not change from stage 1 to 2 overnight. Okay, so it takes a lot of time. And again, it depends on the nature of the breast cancer. Where is it coming from? For example, if it is coming from the lobules, it is less, I would say, invasive if it is coming from the ducts. Okay, so it depends on where it is coming from, what is the type of cells, what is the age of the patient, and so many factors determines how fast it can progress. Some of them, they are slowly progressive, and some of them are fast progressive. But in general, they take years and years to grow and to progress. Okay. That's it.
All right, we still have room for any questions. So if anyone else would like to follow up.
Thank you again for the presentation. Do you have any records, like how long the cancer may remain unnoticed, and to process from stage 1, when at what stage become painful and already noticeable, which is the stage critical?
Yeah, thank you for this question. This is very important, because the reason why we are emphasizing the importance of screening, which is mammogram, for example, is because mammogram can detect cancer 2 years before it becomes palpable. Okay, so before you notice any changes, the mammogram can detect the changes. And that's why mammogram is really important, or other screening is really important, because they can detect the cancer before you be able to notice it, or you see it as a bump or as changes. So your question again was about how long it takes?
Like at what stage becomes painful and already?
Yeah, so as I said, we are trying to detect cancer as soon as possible. So in a stage 1, you might feel a very small lump, okay, between 2 centimeter and 5 centimeter, a very small lump in the breast. That would be stage 1. Okay, so and then if you feel lumps in the underarm, for example, that would be involvement of the lymph nodes. That would be stage 3. And then if you have symptoms not related to the breast, such as cough or abdominal pain or so on and so forth, this means other parts of your body now is being affected. So that's a stage 4. So every stage has different kind of symptoms, and the mammogram or the screening can detect, as I said, the cancer before it starts to give symptoms. So there is what we call preclinical stage before you have any symptoms. And this is where we want to detect cancer, because this is very, very early stage of diagnosis. And when the cancer is removed or treated at this stage, the woman can live absolutely a normal life with absolutely normal survival.
We see a lot of
too long, exactly. Very late presentation.
Exactly. So that from our presentation, so that means probably there is not that severe pain to
Yeah.
take them to the hospital. So
Exactly.
we're really hoping that
It'll go away. Yeah, yeah. Or hoping that this is something not serious. So like you said, and this is really documented in the literature, our women in this part of the world, they present very, very late in the course of the disease for the reasons you've mentioned: sensitivity of this part of the body, reluctance to go and getting checked, feeling embarrassed or ashamed to be seen by a physician or by a male physician or so on, or having this part exposed. Or even scared to know the truth. Yeah, even scared to know the truth. So this results in late presentation, and this is something we don't want to see, really. And that's why we do all those campaigns and awareness campaigns, because we want them to come, we want to encourage them to be able to come and get themselves checked. Okay.
Would anyone else like to address the doctor with a question? Okay. Well, I have a question. We've always heard that in this region of the world, breast cancer is more aggressive for our people. So can you explain why is that?
Sure. So you guys are very, very knowledgeable in breast cancer. So yes, again, the research has shown that in this part of the world, it's not only late presentation, but usually it is more aggressive. And second, women present at an earlier age. You know, so when the average age of presentation is in the 50s in the West, it is in the 40s in this part of the world. So we do see younger women with breast cancer, and it is, like you said, could be more aggressive. And it is known that younger women get, unfortunately, more aggressive type of cancer. Now, we don't know why exactly. Is this related to age? Is this related to something else? Is this related to the genetic composition of the cancer? We don't know exactly why it is more aggressive, but it's definitely, like you said, this is a fact that we see. Maybe because it's among younger generation. Maybe it's related to the fact that we start our families earlier, so our women get married at an earlier stage or so on. But again, all of this has to be studied in very well conducted epidemiological studies so that we know a final and definitive answer for your question.
Thank you, doctor. Space is open still. If anyone would like to ask a question, please raise your hand. I think that concludes our session.
Yeah,
thank you, doctor, for your presentation and taking your time to inform us about this
Thank
topic.
you very much for having me. Thank you for the interesting discussion, and hopefully I will see you soon in other events. Thank you.